Hey everyone, this is Dr. Harris with Harris Internal Medicine. I'm putting up another post for you guys, and this one is actually a little bit more about direct primary care. So I had a patient who I saw about a couple weeks ago, and she was in the office and she was trying to get all of her questions answered at the time. And she said, I don't want to leave and not have all of my questions answered, because if I leave, I need to make sure that I have all those questions answered. And I told her, the good thing about direct primary care is that you actually can call me. If you leave the office and you forget to ask a question, you can actually always call me back and say, hey, I forgot to ask you this, or I didn't remember this, or this is the medication I remember that I was on. And so I don't know if you remember in I call my pre-direct primary care days. I would have a patient who would forget, and they would call back and they would have to go through the phone triage and speak to a nurse or my medical assistant, and then the triage nurse, and then the triage nurse would ask a question, and then I would call them back, or the triage nurse would actually answer the question, and they didn't actually get to speak directly to the doctor when they had a question or something they wanted to be answered. They would actually talk to the nurse most of the time, and that was just unfortunately the way that the office was set up and the way that the office ran. But now, in my happy days in direct primary care, a patient, if they have a question or they forgot to ask something, they have something over the weekend, they have a question about, do they need to come in, do they need to be seen, or I forgot to ask you about this, they can ask me directly. They can call the office, and of course most of my patients know I will answer the phone and give that answer to them directly. So no fears if you leave the office and you can't remember something, or you forgot to ask me something, you can call me right back. The beauty of direct primary care, I love it. So if you guys want to know more about direct primary care or have more questions, you can log on to our website at www.harrisinternalmed.com. And there's some explainer videos about direct primary care on the website. And of course, if you want to come in our office for a free consultation and visit, not a visit, but a free consultation, you can come in our office and visit and ask more questions also. So you guys have a great day, and I'll see you next week.